Back now, heart disease. It is the leading cause of death for women here in the U.S. So with February being Heart Health Month, and this afternoon we are honing in on what we as women can do to stay heart healthy. With us is Dr. Carolyn Gbur with ProMedica. Doctor, thanks so much for joining us.
Thank you for having me.
Now, okay, so when I think, because we were just having this conversation, when I think heart health is necessary, well, I'm young, that's like an old people thing. It's fine. Heart health really only affects like the more seasoned population. Why is that wrong?
Well, it's wrong because eventually at least 1 in 3 women will have some form of heart disease. So younger women tend to have more problems with heart rhythm abnormalities where they skip beats or feel their heart race and palpitate. As you get older, you start to get more diseases like high blood pressure, diabetes, and then that adds to the risk for heart failure and for heart attack.
So then, in a sense, when I know something like this is off, instead of doing what most women, we power through and we continue on because, you know, things need to get done. The house needs to be, the babies need to be taken care of. What should we do?
Well, pay attention to your body. You know your body better than anyone, and don't be afraid to ask for help. So, you know, doctors love to help people, but we're not mind readers. So you need to advocate for yourself, go to the doctor, tell them what you're feeling, what you're experiencing, and try to figure out what the cause is. It might be something very simple and very easy, or it might be something that could be much more dangerous down the road if it goes untreated.
I know for me, sometimes I'm always worried about what if someone doesn't believe me? What if it's, you know, it's perceived to be all in my head, because the symptoms for men versus women when it comes to heart attacks and certain things were not similar, right? So are there certain signs, symptoms that I can say, okay, no, you're not being silly. This is a problem. You need to go get this checked out.
Well, chest pain is obviously the big one. So, I mean, there are literally 100 different things that can cause chest pain or shortness of breath that people can be worried about. So typically, artery blockages that cause heart attacks, the symptoms will happen with exercise or activity and get better with rest. So some of the other causes like stomach causes or muscle joint pain may happen at rest or laying down or after eating. Or with, you know, like muscular kind of activity. But heart stuff should happen with exercise, and it doesn't matter what kind of exercise or activity, it should be pretty reproducible. Women also tend to have less typical symptoms. I can't tell you how many women have come in the office and have just been tired and short of breath and have never had any chest pain, but those symptoms actually came because their arteries were blocked.
Oh. So then, obviously, don't ignore, communicate with your doctor, be
Correct.
aware of what's going on. But really just don't diminish the fact that this is important.
Right, right. And again, women tend to focus on family and other things and less about themselves, and they make excuses like, oh, I'm just out of shape, or I'm tired, or, you know, but when it actually could be something much more serious.
Now, let's say that I'm fine. I'm in perfect pinnacle, not at all, perfect pinnacle of health, but I still want to show my support. What are ways that I could, in a sense, you know, maybe definitely encourage other women to get checked out apart from being on TV? What else could I do?
Well, take care of yourself, so diet and exercise, you know, try to eat healthy, you know, not a lot of caffeine, not a lot of alcohol. Quit smoking, and people that you're around, if they smoke, try to get them to quit smoking because you're still going to get some secondhand smoke, which can also affect you. You know, try to exercise, you know, as much as you can within realistic limits. And if you can't get a lot of time, even doing smaller episodes of activity multiple times throughout the day or throughout the week will all add up and all help. Treat what you can treat. You know, people that have family history, you know, it's not necessarily an automatic that you will have heart disease, but you have to be more careful than somebody perhaps that doesn't have that, you know, family history for premature heart problems. So treat what you can treat. Check your blood pressures, check your sugars, check your cholesterols, and, you know, be proactive with the things that you can treat. And like I said before, pay attention to your body. If you think there's something wrong, you might have to, you know, really push sometimes and really advocate for yourself to get more testing done or to get, you know, more things looked at.
But don't explain it away, or don't wish or hope it goes away on its own.
Exactly.
Fine, I'll acknowledge that I might need help. Doctor, valid. Thank you so much for taking the time. Lovely red dress. It's on purpose. Again, it's always about doing this and being aware and being cognizant of yourself, because you matter just as much as the rest of your family.